Our top story now, helping kids in crisis. There are many children struggling with mental health issues who would best be served by seeing a child psychiatrist.
The problem is that it's often difficult to find one and get a timely appointment. Problem solver Melissa Hippolyte takes an in-depth look.
It's 2 against 1.
Mikhail Williams is at ease, tossing a ball around with his family in their Emporia yard. The 10-year-old has ADHD, and on this day, he has his medicine. But about a month ago, he ran out.
He shakes really bad. He gets like really bad shakes. His body movements shakes.
You could have caught that. I feel like I'm about to pass out and I get hot.
Mom, Michelle Penn, says Mikhail was scheduled to see a child psychiatrist at VCU Health Community Memorial Hospital Behavioral Health in South Hill, but days before the appointment, the office canceled because the doctor left the practice. She had just started in March, and there's no plans to replace her.
I did ask could they refill their prescriptions until I figure something out, but...
So what did they tell you?
No. It would have to been Dr. Anise.
Penn tried to get her son's family medicine doctor to write the prescription for the ADHD meds, but
she said that she had to get referral papers from the care building before she could refill their prescriptions.
There aren't any other child psychiatrists in the area, so Penn felt she had no choice but to take Mikhail to the emergency room.
Nobody likes to go to the emergency rooms, and we had to wait on a school night to get him medicine.
Mikhail's story is not unique.
They got Mario Kart.
Destiny Walls lives in Midlothian.
Mario Kart.
She says she's been trying to get her 6-year-old son Killian in with a child psychiatrist since January of 2019.
Everywhere's like a 6-month waiting list, and by the time that 6 months comes up, they call and they cancel, and you have another 6 months to wait. We ended up going to the ER because I wanted to get him looked at in a way.
This map from the American Academy of Child and Adolescent Psychiatry shows there is a severe shortage of child psychiatrists in Virginia and elsewhere. Here's Rachel Reynolds with the Virginia Mental Health Access Program.
Part of that is the amount of training and the requirements that it takes to become a psychiatrist. But the other piece of it has a lot to do with what insurance will bill for, what requirements there are within the state for licensure, things like that.
And the problem is just getting worse, with more and more children needing behavioral health services since the start of the pandemic. Nelson Smith is the Vice President of Behavioral Health for Chippenham and Johnston Willis Hospitals.
We've definitely seen an increase in volume in our pediatric and adolescent populations here. And I imagine it's just a scary thing to hear your child, if they were to say that they want to hurt themselves, you don't know what to do. And the first place that you think of is your community hospital, your emergency room.
According to a recent survey conducted by the Virginia chapter of the American Academy of Pediatrics, 90% of providers reported seeing more behavioral health issues since June of 2020. 82% perceived the number one concern for patients was having access to child and adolescent psychiatrists, and 62% did not feel they were able to meet the increasing behavioral health needs of their patients.
We do know that Virginia ranks 41st for availability of mental health professionals in our mental health workforce. And so we know that there really aren't enough psychiatrists or even other mental health providers to meet the growing demand that we have.
To try to help, a grant awarded to the Virginia Department of Health allowed the state to set up the Virginia Mental Health Access Program, or VMAP. Pediatricians and other frontline doctors that see kids can call VMAP and consult with a child and adolescent psychiatrist about a patient.
With a 15 to 20 minute conversation between the PCP and the psychiatrist, they can get the guidance that they need to send the family on their way instead of waiting 3 to 6 months to see a provider.
Reynolds says 648 providers registered to use the system, and the psychiatrist receives 6 to 8 calls per day. But there's still a need for awareness about the free program. It sounds like a lot of providers maybe don't know about the program.
Exactly. We know we need to do a lot more to get information out to the community about, to the primary care community about what's available to them.
Also a long-standing issue, access to inpatient psych beds for children, something Destiny Walls learned when she took her son to the Chippenham ER.
And I was like, well, is inpatient even an option at this point, because we've been fighting for so long? And they said, you would be sitting in the ER for 3 to 5 days before getting a bed.
There are kids that do wait several days. We're one of the few places that have child and adolescent beds. You have us, there's a place in Petersburg, there's just a big shortage of beds, I think, for child and adolescent.
So if there's a need, we asked Nelson Smith, why not add more beds?
Sure, I mean, that's a good question. I mean, there are lots of places that I think I don't know.
Felicia Wilson, the head of clinical services at Chippenham Psychiatric Hospital Tucker Pavilion, said it would be hard to staff them.
Staffing has been extremely difficult during this time. I think a lot of our older staff have retired.
Which brings us back to Destiny and Michelle.
Go this way.
It's hard.
Who say more needs to be done to help kids in crisis.
I feel like, they should have more resources for the children.
Now, to try to improve the staffing issues, the General Assembly just this year approved a student loan forgiveness program for folks that pursue behavioral health opportunities in underserved areas. Child and adolescent psychiatrists are included in the program.